I'm David Buchalter. I'm an orthopedic surgeon. I specialize in sports medicine and do all the things that sports medicine docs do, including joint replacement and all that good stuff. So Greenspring Surgery Center is a surgery center in suburban Baltimore that is one OR, 2 procedure rooms. We have never used really the second procedure. We use one procedure room for pain. We use another procedure room somewhat, but not fully. We do some local hand cases and things like that in it. Greenspring Surgery Center is almost, not quite 20 years old. When we started, it was part of our orthopedic practice of about 15 doctors. We kind of did it in-house and realized that we were having some trouble kind of managing and running it. Administrator at that time just didn't kind of have the wherewithal. So we sought an equity partner. We had an equity partner. It was a small boutique equity partner, and we did okay with them. We were able to, it was a highly leveraged center. We were able to make a little bit of money. In fact, maybe I shouldn't, Robert Eisenberg was actually the administrator, nurse MBA administrator of Greenspring Surgery Center at that time. So that's how I met Robert. That center then sold to a national management company. And we were told that it was going to be great, all the advantages that Robert showed of a national management company. One thing led to another, and the bottom line is it just was never a fruitful relationship. Periods of where it kind of seemed like, maybe a little something, but for the most part, not good. So after some years of not making any money, frustration with leadership, partners, you know how it is, your partners start to get frustrated, you're frustrated. We said, look, we've got to get this national management company out. It is a terrible relationship. It's not good. Nobody's making money. Nobody's happy. Everyone's just frustrated. So at that point, we started thinking about not only how to get them out, but what to do afterwards. And Robert is someone who I had worked with previously, was one of the people I contacted in sort of consulting and saying, hey, here's kind of where we are, here's where we want to go, and here's what we want to do. So my job today is really, I'm going to tell you a little bit about us and our experience, and also I'm going to tell you some of the things that Robert really can't tell you himself, which is why you should consult with Sullivan Healthcare Consulting. Kind of the real reasons why, besides like all the reasons here, like we're very organized, we do things a certain way, we know what we're doing. But the real reasons, I think, are that you can trust Sullivan. And I think that's the biggest thing. I think that we're all, I don't know exactly where everybody practices, whether you're independent or whatnot, but the bottom line is I think we all look at ourselves as generating cases, generating revenue, we're charging hard, we're doing our part. But we can't do everything, and it's kind of hard in this world to kind of run everything completely. But how do you maintain autonomy? How do you maintain independence, yet have good partners who can help you become profitable and happy? And that's what we've experienced with Sullivan over this many-year journey at Greenspring Surgery Center. So I think if we go to this slide, what I can tell you some of the challenges were. With the national management company, there was ineffective leadership. One of the biggest things is they would hire administrators for us. And they were just filling spots. Some of these people kind of knew what they were doing, some of them didn't. But it's just kind of a big, amorphous company, and they were just kind of filling spots, and we were trying to make the best of it. And they just weren't particularly good. We also had a revolving door of vice presidents. So the vice president from the national management company is supposed to be kind of your liaison to all the benefits of the national management company. But we would have, it was like every 8 to 10 months, they would just reorganize and move people around. You never could develop a relationship. You could never get any of that customization. And they were always trying to sell you the national management company's agenda, not your specific agenda and needs. They were always trying to, this path, a total joint pathway. We'd already developed a total joint pathway on our own. We didn't need theirs. Bundles. I'm in Maryland. Maryland, you just can't do bundles. It's really, really hard to do bundles. A little bit here or there, but they were like, we're all about bundles. We're like, that would be awesome. We're all for them too, but our experience being on the ground here in Maryland is that can't happen. So there just wasn't this alignment. Other things, regulatory and compliance, and we had a few things. We had some issues with timeout that Sullivan was able to come in and introduce. Operational inefficiencies. We would have 8 nurses sometimes for a day with 1 OR, 1 pain room, and a procedure room that we use sort of real sporadically for little local hand stuff. We all know you don't need 8 nurses. How did we have 8 nurses? There was no leadership. It was the tail wagging the dog, and we knew that was the problem. We saw the problems. Everyone loves the nurses, but nobody wanted to do anything, and we really needed leadership to come in and say, look, here are benchmarks, here are standards, here's how you get your expenses under control. Financial performance, look, as I said, we were getting minimal to no distributions. One year working with Sullivan, we distributed $800,000. And there are 10 of us. So listen, I'm sure every geography is different. Maryland's a tough payer place. But I think for each of us to make $80,000, we had not made that much. And for each of us to do that when we were kind of getting a little here or there, that was like in 1 year, it's a really good move. And they were able to do some very concrete things that we needed help with. Contracts, we had underperforming folks doing revenue cycle management. So we brought revenue cycle management in-house, which again, tailored to what we needed. We didn't need an administrator on site necessarily, so we were able to eliminate some expense there. In this post-COVID world, we're able to do sort of a hybrid kind of remote type of thing that works really well. Supply chain, we had some poor inventory management. Again, the national management company didn't have skin in the game, okay? They were making money, they had equity, okay? Not a lot, but they had equity. They had a management services fee based off of revenue only, okay? So they did not care how much, if the lead nurse wanted 8 nurses there, great. If that keeps her happy and everything, great. That costs money, If your inventory is not tightly managed, who cares, okay? And so they were making their money anyway. They were associated with a number of other kind of subsidiary and smaller companies who they were kind of in bed with, and they were kind of trying to feed each other and make their money that way. Their model was not aligned with ours. So Robert mentioned a word, customization, and I think that's really what you get with Sullivan Consulting, is they come in, it's a small outfit, they don't have an agenda other than to help your center do better. They want to make money. They're going to charge you a fee to do the work, okay? But they don't require equity. And one of the things that we were able to do is we were able to arrange a financial thing where it was not just off of revenue, but also included expenses, which is something that we knew we needed help with. So Robert and I were able to craft something that was based off of EBITDA. And I think that's what we were looking for. We were looking for an arrangement that would be well aligned where if we do better, they do better, and we've been able to find that with Sullivan. So this is actually really easy for me to do. What we wanted, exactly what I said, deep expertise, flexible partnership model, great results, and that's what we've gotten. Robert, as he mentioned, he brings in subject matter experts. So one of the things we needed was revenue cycle. So we were able to get a really incredible person to help with billing, revenue cycle, bring all of that in-house. Flexible partnership, again, the customization, great results. I told you a little bit about that. Happy to share more. And then what did we do? The board got excited because we were able to do these things that like we knew we needed to do, but we didn't have a partner to help us do them. We were coming up with solutions. We were able to right-size the staff. So now that we're not paying, out the wazoo for staff, and that makes the staff actually feel better because the staff is feeling like, hey, there aren't all these people running around or not doing anything. Everyone's engaged, working together as a team to their full capabilities. Effective hands-on leadership. Robert's brought in people who have really been able to help train our staff. Rigorous oversight of operational processes, making sure that everything's running smoothly. Revenue cycle management in-house, huge benefit. And then ending some low-value vendor relationships. So you can see some of the befores and afters. And again, this is just in a year, okay? So this is really a great turnaround. Satisfaction, better. Patient complaint. Infection control, better. The turnover times, better. Collections, days in AR. Really everything, all the key indicators are... we're doing better, and as a result, everyone's happy because we're getting checks. And I think that's kind of when you're a busy orthopedic surgeon, you're bringing the revenue, you need a partner who's going to help you to realize, what we all know, that a surgery center can be safe, effective, and financially profitable. So we're very happy. This is easy for me to do, and happy to answer any questions that you all might have.